to put this in perspective, we are in the middle of the influenza season, and we're talking here about the virus that has caused 9 deaths among 440 cases that have been actively sought. That is not that different, actually, from the regular, everyday, every year seasonal influenza. So this is very different from SARS. So far, we don't have any indication that this would be a highly pathogenic virus.
SARS, of course, the virus in 2002, which did claim many lives. This is a new strain, not previously to have been identified in humans. How difficult will it be from a perspective of health security to monitor passengers coming into Europe who could be infected with it?
Well, to be honest, I'm a bit surprised that so many countries have gone to this. WHO is the World Health Organization is very clear in their recommendations that this is not very helpful. And the reasons are that it's actually impossible to catch everyone in a connected society that we have nowadays. Most people will not show symptoms when they are exposed immediately. So this is a bit more show than actual effect. I would put my emphasis on strengthening healthcare services and the preparedness there so that you can actually detect the cases and get them into treatment and isolation if necessary.
So you've just heard our correspondent in Moscow. You think the procedures that they're putting in Moscow airport then are almost futile?
In the long run, I think if it's so that this is really easily transmissible, it's probably futile because all previous studies and also modeling shows that you can maybe push the start of the outbreak in different settings with a couple of days or perhaps weeks, but that's about it. So the resources would be better spent in preparing the healthcare sector for whatever is coming.
Whatever is coming is clearly what people are trying to anticipate and also limit as well. If people are travelling, particularly through China, what precautions should they be taking?
Yeah, I think the important things is to take care of good personal hand and respiratory hygiene. So frequent washing of hands. I think it's still pertinent to avoid some of the market settings, although I think we are past that stage because there's more and more evidence that there's community transmission. But keeping hands clean, avoiding very crowded situations if you can, which may be difficult in this setting, I think is the best advice.
Thank you very much for your analysis, Professor Mika Salminen, a specialist in health security. Appreciate your time.